How are you, doctor?
Fine, sir. How are you?
Okay. Okay, see, you are entering in EMC. So, what do you think? What are the qualities a doctor must have before entering in EMC?
Okay, sir. Before entering to AMC, a doctor must possess some skills to handle basic emergency procedures, sir. Procedures and to tackle the patient. Mainly in AMC, sir, we have to know to tackle the snake bite, anaphylaxis treatment, and chest pain, MI. All these all these basic diseases should able to treat by by the doctor, and he should know how to conduct the delivery. Uh, then he should develop good analytical skills, sir, because in emergencies the time matters. So he should have a good analytical skill. Then he should have good leadership skills, and he should be able to work with the team, and he should be versatile and flexible, and he should not be submissive. He should say
Enough.
no to the things which is no.
Enough. One personal question from you. You joined
Okay,
on
sir.
24th and today it is 29th.
Yes, sir.
Today it is 29th. How are you feeling at PD classes?
Okay, sir. I feel confident
Okay.
because, sir, from the first, sir, I was so not confident, and I think whether I will get selected or not. But now I know I know how to tackle the interview somewhat. So I feel confident I can tackle the interview, sir.
Doctor, many
Because
people are,
the
please
speaking
continue.
matters. We know, sir, we will study, but in the interview, we feel very difficult to open our mouth. We utter the words. But if we practice with someone, sir, and who is in the field for many years, it gives us confidence, sir.
Doctor, many people are not only for doctors and all this, many people are saying, sir, 7 days, it is very tough. Not possible for anybody to groom up. So, what are your views now? Is
Yes,
it enough?
sir. First, yes, sir. I think it is enough, sir, because the first 3 days you give all the personal questions and body languages and everything, and after 3 days you give medical questions. I think this is enough, sir, but we have to read a lot more in medical question because it is a vast.
Yes.
But body languages part and personal question part, you take care everything, sir. We don't need to search and read. You took care of everything. But personal subjects, but in medical subjects,
Subject. Very
it is
vast. Okay.
vast, so we have to keep
Even
reading.
you can teach us the subjects. What is the role of medical officer?
Okay, sir. So, medical officer, first of all, he or she should attend the OP
Okay.
and attend the inpatients if any, and allocate works to the PHC staffs, timely monitoring and correcting them,
Right.
collaborating with other departments for the welfare of the public, and maintain adequate medicine supplies. Then adequate medicine supplies should be monitored, and good record keeping, proper documentation should be done. Then good sanitation procedure and nutritional programs should be taken care. And the main role of a medical officer is planning and preparing and implementation of the programs to attain the target of universal immunization schedule and the national health programs. Then implementing family planning services is or also the part of a medical officer's work. Then fortnightly attending the sub centers and Anganwadi centers and the school visits to ensure the nutrition, sanitation, and proper health of those public. Then monthly meeting to review the progress and to attain the goal of the universal immunization schedules and national health programs.
Okay, now you tell me, what are the mosquito-borne diseases?
Okay, sir.
And the name
So
of the
mosquito
mosquitoes
borne.
also.
Okay, sir. So the mosquito Plasmodium, it causes malaria, sir.
Yes.
Plasmodium has four types: Plasmodium ovale, vivax, falciparum, and malaria. Then we have Aedes aegypti mosquito. It causes dengue, chikungunya, yellow fever, West Nile fever, Zika virus, Zika diseases.
Yes, yes.
And we have Culex mosquitoes, it causes Japanese encephalitis and also West Nile diseases.
Okay. So can you tell me something about the doses of chloroquine?
Okay, sir. So the chloroquine dose is 25 milligram per day, sir. It should be divided into 3 doses, three days. So first day we have to give 10 milligram. Second day we have to give 10 milligram, and third day we have to give 5 milligrams, sir. It is for malaria, used to treat malaria.
Okay. Tell me something about the water purification techniques.
Okay, sir. So water purification techniques, we have small scale and large scale, sir. Small scale, we do household purification and the disinfection of the wells. In household purification, we do boiling and adding disinfectants such as chlorine and other disinfectants. In disinfectants of the well, we do chlorination and also bleaching powders to be done, and the double pot method is also used to purify the well water. Then in large scale, sir, we have three process. So first one is storage. So storage for a long time, the dusts and all sediments down. So we can purify from the storage method. And second method we have uh, filtration methods, which we use as sand filters. We have small sand filters and also large scale sand filters. We use two types. First one, we use biologically, sir. Biological agents such as algae are used to purify the water. In a large scale, we process the water like a flocculation, sedimentation techniques, and to purify the water, sir.
Okay.
Thirdly, we have disinfectants, disinfectants such as chlorine, and UV rays also used to disinfect the water, sir.
Okay. What is the doses of corticosteroids dose for lung maturation?
Okay, sir. Lung maturation corticosteroids, sir. We have two, dexamethasone and betamethasone.
Yes.
So dexamethasone we give 6 milligram, 4 doses, 12 hours apart, sir.
Right.
Betamethasone we give 12 milligram, 2 doses, 24 hours apart, sir.
Wonderful. Okay, now tell me, insecticides in malaria.
Okay, sir. So insecticides in malaria, we use pyrethroids such as permethrin. We use carbamates such as propoxo. We use DDT, diphenyl ditetrosodium chloride. We use DDT, and we use malathion, all these insecticides, sir.
Okay. Can you give a classification of antibiotics?
Okay, sir. So classification of antibiotics, we have fluoroquinolones such as ofloxacin, moxifloxacin, levofloxacin. We have sulfonamides such as sulfamethoxazole, sulfamethoxazole sulfpyrin. Then we have beta-lactams such as penicillin, cephalosporins, ampicillin, amoxicillin. Then we have macrolides such as erythromycin, azithromycin,
roxithromycin,
clarithromycin, sir. Then we have.
Do you know among these one
tetracycline.
antibiotic is there? Azithro, clarithro, roxy. One antibiotic is there which is to be taken prior food. All the antibiotics we know we take after food.
Yes, sir.
So can you tell which antibiotic it is?
Prior food, sir.
Prior to food.
I'll read about.
It is azithromycin.
Okay, sir, I'll read. Azithromycin is taken after food, no, sir?
No, it is taken prior to food. No, we can take after food, but better results
sir.
comes with prior to food.
Oh, okay.
Check somewhere.
Sir. But okay, sir. In our hospitals, we prescribe after food.
You usually give after food only. It's very common,
yes.
But it
yes,
comes up. Okay, now you tell me COVID discharge protocols. I have written few important questions for you.
Okay, sir. So COVID discharge protocols. So mainly we keep the patients for 10 days after admission to monitor the vitals of the patients and the temperature of the patient. So we have to discharge after 3 days of the afebrile phase. If the patient is afebrile for 3 days, then we can, without antipyretics, we can discharge the patient. Then the patient should have oxygen saturation of 95%. He should breathe without oxygen support. We can discharge the patient, and his symptoms are such as fever, breathlessness. If all these are reduced, then we can discharge the patient, sir.
Okay. If I ask you about upper GI bleed.
Okay, sir. So upper GI bleed, most common causes peptic ulcer, sir.
Yes.
A duodenal ulcer or perforation leads to upper GI bleed. That's it, sir.
Okay. Don't worry. About lower GI bleed.
So lower GI, we have Crohn's disease, we have rectal carcinoma, we have hemorrhoids, all these things, sir.
Okay. What are the third generation cephalosporins?
Okay, so third generation cephalosporin, we have ceftriaxone, cefotaxime, cefixime, ceftibuten. That's it, sir.
What are the risk factor for breast CA?
Okay, so risk factors for breast carcinomas are mainly PCOS, polycystic ovarian syndrome, then nulliparity. Then if the mother is not breastfeeding, it would lead to breast cancer. Then elderly age. In genetics, BRCA mutation also lead to breast cancer in genetics. Smoking, alcohol, all these can lead to breast cancer. That's it, sir.
What are the causes of pancreatitis?
So causes of pancreatitis, we have acute pancreatitis and chronic pancreatitis. In
Yes.
acute pancreatitis, the most common cause is a gallstone. So gallstone is the main reason for acute pancreatitis. And others such as infections can lead to pancreatitis. Autoimmune diseases can lead to pancreatitis. And any obstruction such as strictures, carcinoma, distal to the pancreas can lead to pancreatitis. And alcohol also. In chronic pancreatitis, the most common cause is the alcohol. Alcohol is the main reason for chronic pancreatitis, and trauma and drugs. Some drugs causes pancreatitis. Then that's it, sir.
Can you tell me about stab injury?
Okay, sir. Sir, stab injury, first we have to stabilize the patient, sir. ABC, airway, breathing, and circulation. And we have to look for the circulation mainly. If he is hemodynamically stable, we can proceed with investigation and treatment. If it is hemodynamically unstable, we have to start the blood transfusion as soon as possible, and we have to do laparotomy and to close the wound as soon as possible, sir.
Okay. IVC filters.
Okay, sir. I need to read about it, sir. I need to read about it.
Okay. Tell about ACL and BLS.
Okay, sir. ACL, we have advanced cardiac life support, and BLS, we have basic life support. In basic life support, sir, if someone is collapsed in public, we have to we have to go to the patient. First, we have to call for help. Then we have to assess the pulse for the patient. Then if the pulse is too low, we have to start the CPR as soon as possible till the medical team arrives. So we have to give 30, if I am the only rescuer, I will give 30 CPR, 30 chest compressions plus 2 breaths I will give. If 2 rescuers are there, we have to give 15 compressions, and we have to give 2 breaths, and we have to continue the cycle, sir. And if the medical team arrives, we have to give the patients to the medical team, and the medical team will take care of that. The medical team have many advanced life support procedures, such as they have oxygen, they have a defibrillator, automated external defibrillator. They will use that, and they will resuscitate the patient, sir.
Okay, you tell about hernia.
Keep reading. Okay, sir. Sir, hernia is a protrusion of organs through abdominal defects. So we have 2 major hernias, sir, direct hernia and indirect hernia, sir. So in direct hernia, sir, the hernia protrudes through the defect in the posterior wall. In indirect hernia, the hernia enter the inguinal canal, and it comes out through the superficial inguinal ring. So we have direct hernia, indirect hernia, and other types of hernia are we have obstructed hernia, we have strangulated hernia, we have if it comes in inguinal, it is inguinal hernia. If it comes in femoral, we have femoral hernia. And regarding the content of the hernia, we have many types. It is if it is a Merkel's diverticulum is a content of hernia, it is called Litter's hernia. If it is a part of circumference of the bowel is the part of hernia, then it is called as a Richter's hernia. So there are many types of hernias. So first, most commonly we have inguinal hernias. So how to differentiate the direct and inguinal hernia? We have three tests: ring invagination test, little finger invagination tests, and the size. In femoral hernia, it is a globular. In indirect hernia, it is a fusiform like shape. So we can differentiate that. And we do hernia repair surgeries. Light and most commonly done hernia repair surgery is Liechtenstein hernioplasty, sir.
Tell me about the most important question which is being asked mostly in these interviews: ectopic pregnancy.
Okay, sir. Sir, ectopic pregnancy. So the implantation occurs other than uterus is called as ectopic pregnancy, sir. The most common site for ectopic pregnancy is ovary, and other sites to be implanted or abdomen and ovary and abdomen, ovary, cervix. So fallopian tube, these are the other sites the implantation can occur, sir. So ectopic pregnancy, first we have to take a proper blood investigation. Mainly we look for HCG of the patient, sir. So if the HCG is doubling after 2 days, then we can say, okay, this is intrauterine pregnancy. If it is slowly increasing rather than doubling, then we should suspect ectopic pregnancy. So if it increases more than doubling, then we can suspect molar pregnancy and also. So after and another investigation to diagnose ectopic pregnancy is imaging modality such as ultrasound. Most commonly, transvaginal ultrasound is done to look for ectopic pregnancies. So after diagnosing ectopic pregnancy, we have to look whether it is treatable by medication or it is treatable by surgery. So if the size is less than 5 centimeter and if the ectopic pregnancy that is not ruptured and the HCG is less than 2,500 international units, then we can follow medical treatment. That is, we give single dose methotrexate, and after 7 days we have to look for again the HCG, and we give methotrexate like 3 doses. So if the patient is hemodynamically unstable and if the pregnancy is ruptured and if HCG is more than 2,500 international unit, so we should do surgical repair, sir. The surgical repair we do salpingectomy to the patient, sir.
What is whiplash injury?
Okay, sir. Whiplash injury occurs when the patient is in the same motion, and if the sudden resistance comes, the patient may go to one front. So this causes the brain to move to one front inside the skull. So this causes concussion to the brain and it causes whiplash injury, sir.
And what is raccoon injury? Raccoon signs.
Okay, sir. So raccoon sign is also called as panda sign. It mostly occurs in the anterior cranial fossa injury. In the anterior cranial fossa injury, the blood seeps down and it forms around the both eyes. So it looks like raccoon or panda. So it is called as raccoon sign or panda sign.
What is battle sign?
Sir, battle sign is middle cranial fossa injury, sir. The blood seeps out and forms behind the ear. So the bruise is formed behind the ear. It is called as a battle sign, sir. Mostly occur in battlefield. So it is called battle.
And what is barotrauma?
Okay, sir. Sir, barotrauma is occurring when the person is exposed to high air pressure. So the symptoms are bleeding from the nose, bleeding from the ear, and slurred speech, and the patient may have lung injury, and so on, sir.
Speak on intubation.
Okay, sir. Sir, intubation techniques. If first we have to assess the Glasgow coma scale of the patient if the patient arrives. If it is less than 8, we have to intubate the patient. And if the patient is not breathing spontaneously, we have to intubate the patient. So firstly, we have to take the we have to stabilize the ABC of the patient. Then we have to give an IV line to the patient. Then we have to take a laryngoscope in the left hand. We have to gently pass the laryngoscope down the throat. We have to see for the epiglottis. And after seeing epiglottis, we have to take the ET tube. We have to insert it. Then required centimeter is attained. Then we have to secure the ET tube with inflating the pressure cuff with the air in the syringe. Then after placing the ET tube, we have to connect it with the ventilator, and the ventilator will take care of the patient. So all these procedures should be done in proper aseptic precautions. So we have to handle it with proper aseptic precautions.
Good. And can you tell me on HAPE, HAPE?
Okay, sir. HAPE is also called high altitude pulmonary edema, sir. In it occurs because when the person reaches a certain height, that is more than 3,000 meter, 3,000 meter in the hilly area, the patient may develop a HAPE, high altitude pulmonary edema. So it is because the capillaries are inside the capillaries there are increased pressure, and the capillaries are leaking, and all the bloods come to the lungs, and it develop a pulmonary edema. So the patient may develop breathlessness, chest pain, and so on. So we have to treat the patient advise the patient rapid descent, come down possibly, and we should give him nifedipine, we should give him dexamethasone to treat the HAPE, sir.
What does stove chest means? Stove chest. It is also known as frail chest. Can you explain about it?
Okay, sir. Sir, flail chest occurs mostly in the trauma to the thoracic region. So flail chest is described as more than 2 rib fracture in the same single rib, or 3 consecutive ribs. It is called as flail chest, sir. So the flail chest sometimes may lead to pleural effusion, pneumothorax, and so on. So if it is not complicated, we have to treat the patient conservatively. If it is complicated with the pneumothorax cases, we have to give the patient intercostal drainage, proper ABC, give oxygen to the patient if needed, and we have to treat like that, sir.
Can you tell on frostbite?
So frostbite occurs when the temperature is too low, that is below 0 degrees Celsius in the winter places, and it shrink the capillaries. The very low temperature, it shrink the capillaries, and it will not allow the blood to reach the places. So the toes, mostly it affects the periphery such as hands and toes. So the toes may go for gangrene, and sometimes you have to remove the toes for that. So mostly very low temperature shrinks the capillaries, and it does not allow the blood to flow through the digits, and the digits may go for gangrene. This is called as a frostbite, sir.
Speak on food adulteration.
Okay, sir. Food adulteration. So when the food is adulterated with certain foods, it causes food adulteration, sir. So examples may be sir, I'll read about it, sir.
Apoptosis.
Okay, sir. Apoptosis is also called programmed cell death, sir.
Okay.
So the caspase is involved in the apoptotic procedures, sir. Apoptotic factors are BAX, BAL. I need to read about it, sir. Apoptosis.
The process of programmed cell death.
Yes, sir. It's called apoptosis.
Is it?
Yes, sir.
I'm just Google it. Okay, no problem. What do you mean by selective NSAIDs?
So I need to read about it, sir.
Okay.
So I know NSAIDs are non-steroidal anti-inflammatory drugs,
but there are selective ones like rofenicillin is an example. Previously, Sally, Cofziv, and all this come, but unfortunately they got banned.
Okay,
And
sir.
no, rofecoxib is also banned now. Only atirocoxib is working. Atirocoxib. You must have
Okay,
heard
I
about it.
need to read.
Yes,
Yes,
yes.
sir.
Rofi and Sally both got banned. But atirocoxib
Okay,
is working.
okay, sir.
Okay, what is the total dose of vitamin A?
Sir, vitamin A, when it is given less than 6 months, we give 1 million units, sir. When it is given more than 6 months, we give 2 million international units to the patient, sir.
And doses of anti-rabies vaccines and site?
Okay, sir. Okay, sir. Anti-rabies, if it is severe, we give immunoglobulin plus vaccine, sir. If it is mild and moderate, we give only vaccine. So the dose of immunoglobulin is 40 international unit. So the vaccine, we give 0.1 ml on each side intradermally, sir. On each side of in the deltoid region, we have to give, and we have to give for 4 days. That is 0, 3, 7, 28 days. So we have to give for 28 days. So the anti-rabies regimen we are following nowadays is the modified Thai regimen.
Doctor, this is again a personal question. Like
Okay, sir.
we are teaching separately, especially doctor's batch. All other batches
Okay,
I
sir.
am taking together, like lecturers and all that.
Okay,
So
sir.
I have experienced within these 5-7 years that this is better. Although it consumes time, but this gives result. So what are your views? Like in doctor profession especially, do you think that can we teach 5 or 10 together? Do you think?
5 or 10 to, in a single room you are taking.
No, yes,
No,
yes.
sir, I don't.
Not possible.
I
Yesterday,
sir,
one
not
of my
possible, sir.
city doctor has come to me. He conveyed me, sir, I am going for AMC. I told, okay. He told, sir, please help me out with offline. I told, yeah, if offline, then 2 people I can't reach together. It is very tough because you people, your own style and your own lifestyle. We can't go with
Yes,
personal
sir.
and we can't with introductions and all this. Not possible.
Yes, sir. Yes, sir.
So I think
Not
this is
possible, sir.
justified, right? Separate is justified.
Yes, sir.
One to
Separate
one
is
session is
justified, sir. Yes,
okay,
sir.
doctor. It is really a good
So
session.
you can take the body language part,
Yes,
and
body
you
language
can
part we can together, but all other
teach, sir.
part is
But
very,
that is
very different. Like personal questions you are having
very
your
tough, sir.
introduction, you are having your
Yes,
own
sir.
professional questions are
Yes,
very
sir.
different because you are having your own lifestyle. You will answer the same question in different manner.